Why do placental bands happen? Like these, as we age, I hate it. You don't have them when you're young.
You lose elasticity in your skin. Your
in your
tissue
muscle
thins
as
out.
well?
No, but you're seeing the edge of the muscle more because of the loss of the elasticity and the quality of the skin.
That's always been a question of mine because I inject lower face, a lot of lower face neuromodulator, a lot of Botox, and over time you start getting these banding, and I tox everybody lower face and their
It's the same reason why you get lines in your forehead. It's the continuous use of those muscles all your life, and eventually you see those things through the skin. And so we have procedures that we can do to help soften those things. It's not going to make it go away completely, but it helps soften it.
Weird if it was completely gone.
There's surgery, injectables, and there's laser resurfacing. And I think people would like to think, oh, one is the right solution for me. But the reality is the majority of patients, especially as they age further, are really going to benefit the most from a good combination of all three modalities, because each one is designed to address a different element. For example, going back to brow lift, we still do brow lifts, and I think people assume, oh, if I get a brow lift, I won't need to get Botox anymore, because I remember Botox is a brow lift in a bottle. But in fact, Botox doesn't really lift your brow, it drops your brow wherever you put it. It lifts it where you don't put it. So if you put it just here, you can get a compensatory element in your lateral brow, and that's what they originally tried to use Botox for. I think that those spot brows have kind of fallen out of favor, and most people don't like that look anymore. And most people that got that would still get little wrinkles out here where their brows were coming up. But the brow lift will reposition that brow tissue if it's indicated for you. But your muscles are still going to work. You're still going to animate after a brow lift, and then that's where the tox comes in. The tox is to soften the lines. It's not for repositioning your brow so much as for softening the lines.
Right, and when you go to a skilled injector, they know exactly where to place it in order to make the muscles that are helping compensate for your other muscles move in the right direction. I'm gonna aggressively touch your face now. Frown in for me. That's not bad. Raise your eyebrows. Yeah, and I think you need a little bit of tox down here, but I would love, so when I look at a patient and I'm like, what are you comfortable with in the next 5 years? Are you comfortable with surgery, or are you comfortable with just injectables? And then I steer them in the right direction, because that changes my plan and what I'm gonna do with my plan. But I think, with somebody with some laxity and like you, for instance, and you bros, you need to be doing your stuff too, okay? Boys, we want you to have your faces done. But, some volumization, if you're not looking to have a facelift, a lot of times I can affect change by volumizing. This is that band, but that ligament that he was talking about, you can see his retaining ligament right here, where this fat pad is descended and this malar fat pad is kind of more prominent. And so sometimes when I support that with a little bit of volume, that helps bring this up, and it also helps with the nasolabial fold depth and affects a little bit of a lift. What I do is not a facelift, it's not close, but it can be an adjunct to it. A lot of times, even patients after they've had a facelift, or they'll come to me and I'll maybe add some volume to their face, or they'll need some biostimulators.
Or their jawline or their chin.
Right, because he doesn't change your skull, right?
I don't change your actual jawline, but I can change the effective contour of it by lifting up the jowl.
But I can change your jawline.
But she can actually sharpen it back here.
A little bit, so we're a good team.
Give you some chin projection.
Mm-hmm. And so we're always looking at what we can do to affect change in a natural, positive way for you. Yeah, I think that a lot of patients will see me until I get to a point where I'm really honest with them. I'm like, you know what? You need to see Dr. Deuber, because I can only get you to a certain point. And if they're not looking to go in that direction, then I just keep doing what I can, and I move in a way that's going to still be beneficial. But a lot of times, you gotta see him. It just really depends. Or both of us. I think, we work together to make you look natural, look like yourself, just a refreshed version of yourself. That's why we built Lemon Avenue, is because, we want patients to have great continuity of care. We want patients to be able to see Dr. Deuber. You have a plastic surgeon, you have injectors, and you have laser providers and everybody's working together and knows what this hand is doing and this hand is doing. I think that it gets very complex when you jump providers and when you go to different places for different treatments, because I think you're not getting comprehensive care. And that's my biggest thing in this industry is this is healthcare. These things are important. I am putting medications in your body and he is performing surgery. This stuff shouldn't be done in a strip mall. We need to go to places that have providers who really all talk to each other, and that way you can get that care.